Okay. The next speaker is presenting him can be done in a proper way to say that he's chairing the National Patient Organization in Bulgaria. He's the executive director of ELPA, which is the Liver Disease Association, and is also board member of European Patient Forum. A man with his feet on the ground, I would say. And you will give us a view on an explanation or an example, and also an example of the way forward. Stanimir, please.
Hello, everybody. I was thinking how to start today's presentation. I was listening very carefully to the presentations yesterday and also this morning. We have wide range of numbers. We are talking a lot about health inequalities, about determinants of health, numbers about countries, and believe me, the situation in Lithuania is very familiar for me because I come from a country that is probably very similar to Lithuania. It's Bulgaria. And at the end of the day, actually, we are talking about patients and lives. I was thinking what is most important for patients. And when we talk about access and health inequalities, how it affects patients here and now. And I can tell you that whenever you get a disease, a chronic disease, actually you want to have access here and now, because you're fighting for your health, you're fighting for your life. You can't really wait until 2020 until your healthcare system would be better, or let's say 2030, when health inequalities around Europe will be reduced. You want to have access in your own country in the moment when you are diagnosed with the best available treatment in the world, with the best doctor, with the best level of knowledge. So I will try now to focus on some of the problems that patients, particularly in my part of the world, Eastern Europe, are facing. But I'm sure that patients all over Europe and all over world actually are facing similar problems. And if we have similar problems, do we have actually solutions that might work for us here and now, and not in 2020 and not in 2030, but when we need it, at the time when we get the disease? As Anders said, I'm a chairperson of the National Patients Organization in Bulgaria, and I will try speaking on behalf of this organization. But I'm also chairing the hepatitis organization in my country. I'm board member of the European Patients Forum. I have been for a couple of years executive director of the European Liver Patients Association, and some other positions that I have. But that gives me a perspective and knowledge of knowing a situation in a country, but also have some European perspective and some international perspective about the problems of the patients. Just a few words about my organization. In Bulgaria, National Patients Organization is the biggest umbrella group which gathers together more than 80 disease-specific organizations. So the responsibility that we have there is quite huge, trying to balance between the interests of different diseases and different patients, starting from the biggest patient groups like the cardio or the oncology patient groups, and going to the smallest one like the rare disease groups. But I think the responsibility is really great, representing all those groups in front of your health authorities, trying to help them, because it's not easy also for the policymakers to find the best solutions for a country that is well known for having low resources. So from this perspective, I can tell you some facts that probably most of you are well known about Bulgaria being the worst or one of the worst countries in Europe, or the member that actually has many problems. But among all EU member states, Bulgaria actually is constantly continuing to spend really low % of the GDP on healthcare. And yesterday I was thinking when we were talking about sustainable healthcare systems, about cost-effective investments, do you know how my government actually is understanding these talkings? They think this is a good reason to continue cut costs. So a few weeks ago we had a conversation with our government. They really think that cutting cost is actually cost effective. And I think this is not the understanding of patients. And this is not the whole idea. Some of the healthcare problems that we are facing, low reimbursement levels, high copayment level, we have a survey and some data showing that soon, in 2014 and 2015, more than 50% of the healthcare costs will be coming out of the pocket of the patients, which is really a disaster. Administrative burden and lots of things that we have inherited from the past times and the socialist times. No, not to you, not to you. Not at all. In Sweden, you have never had communism, you said before the meeting started. So it's really difficult for people who never lived in such situation to understand what it is all about. Low access to innovative therapies, low adherence to therapies because of undeveloped health infrastructure or low health literacy among the population. Of course, all this leads to lots of problems, like migration of healthcare specialists. You know now it's the free movement of people around Europe, but it's not only migration of healthcare specialists. Do you think if you have a child that actually is sick and you know that your own country is not allowing or not doing enough in order your child to survive, do you think that you are going to stay in this country? You actually will find your way, you will migrate, you will surround the system of more developed countries as Sweden, you will try and you will do your best in order to save the life of your child. So the problems simply don't stay in my country. They are everywhere and they become problems of everyone at a certain moment. So having all this background, we were thinking, if in Bulgaria we do have these problems, do we have similar problems in other countries among the new EU member states? And now I will present you very shortly and briefly an initiative and how we came to some solutions that might work better in future for European citizens. We started with a small survey among patient leaders coming from 11 countries in order to understand if they have similar problems. And this is not scientific research. It was just a simple questionnaire with 4 questions via telephone and via email. And not surprisingly, you will see some of the results here. Most of the answers from the patient leaders coming from the new EU member states were very, very similar. And we have identified some problems that are prominent in all answers. Lack of equal and timely access to treatment all around Eastern Europe and the new EU member states. Limited and unequal access to innovative treatments. Increased financial burden for patients, restricted access to relevant information, lack of lifelong range of services and support for patients, because access is not only access to treatment, it's access to information, it's access to your doctor, it's access to your screening program, and everything else that makes you capable to manage your chronic condition. Then we decided that if we have similar problems, probably we will have similar solutions that might work for everyone. This is how, with the support of the European Patients Forum and with the strong political support from our government at that time, we managed to organize a first conference on health inequalities in the new EU member states that happened last year in Sofia. It was surprising for us that we had such huge interest from the new EU member states, more than 162 delegates. 9 ministries of health were sending us either their experts or ministers or deputy ministers. This showed actually that those countries also need help. And coming back to the question, do we need collaboration and best practices identification? I think this was all about those people who are coming there, seeking for help, seeking for information how we can better collaborate. At this first conference on health inequalities in the new EU member states, we adopted a resolution and we decided that we will have a bigger, more profound survey among patients to see really what are the problems of the patients. Can we wait until 2020 when we will have health inequalities in Europe reduced, or we have to take actions here and now because our lives depends on that, because our economy depends on that, because probably Europe depends on how we deal with our problems locally in Lithuania and in Bulgaria. So the follow-up survey, we had nearly 300 patient leaders from all eastern part of Europe, I mean the new EU member states, and we tried to look into health inequalities and the major problems of patients from patient perspective, not health, not determinants, not life expectancy. Because, you know, when you have to save your child today, you really don't care if you're going to live 72 or 77 years in 50 years. Results were presented at a conference in the European Parliament as a follow-up event. But here are some of the results that gave us a clear message what we need to do and what we need to address in the near future. The economic crisis has had an impact on healthcare systems and subsequently has an impact on the lives of patients throughout Europe. Luckily, in this survey, we were not focusing only on new EU member states, but we also included countries as Greece that are geographically close to us, but also in deep crisis. And at the time of the survey, we had many concerns about access worsening there. Access to healthcare with all its elements, access to hospitals, access to doctors, access to infrastructure, medicines, access to screening, access to information, is actually not one of the main, but probably the main concern for patients in Europe and for their carriers. Then we started searching what the solutions might be, how we can change the system now. Not in 20 years, not in 10 years, not even in 5 years, not even in 5 months. New and innovative approaches to increase access and sustainability of the EU healthcare systems should be explored. And of course, we had certain areas identified by patients, and I think this is very interesting because most of those issues have been addressed in the past 2 days. But exchange of best practices is obviously one simple and very easy solution that might help for countries as Bulgaria, Lithuania, and the others that probably simply don't have the knowledge how to do the things. Quality standards. If we have country that constantly for years refuses to increase their investment in healthcare and actually understands the sustainability and the cost effectiveness in cutting costs, not investing in the right way, what do we do? Can we actually help the politicians there take the right decision and go in the right direction? Is the pricing system right now in Europe actually sustainable? Are the drugs affordable for many of the countries? Can we do it better? And I think in the next room they are discussing some of the issues like the differential pricing as an option for improving access in Europe. So we're sure there are many different solutions around there that might work for patients at the end of the day. We presented these results at an event in the European Parliament, and surprisingly for us, we had quite many MEPs who were coming to this event. And based on this conference in the European Parliament, which gathered together all stakeholders and many people in Brussels to talk about the issues, we started thinking how we could better collaborate, what we can do now in order to increase access, in order to assure access for European patients. Because access is not only a problem for Bulgaria, because the problems are not staying in Bulgaria. They are simply moving to Sweden, they are simply moving to Germany, to UK. What can we do? We understood that we need new collaborative approach, new partnership approach, where all partners could actually seek for solutions that might work now. Based on this conference, you will see what are the next steps we are taking, but European Patients Forum and National Patients Organization in Bulgaria received a mandate from the stakeholders to start searching how we can better collaborate, and we are at this stage now, and I will show at my last slide what are the next steps we are taking. But definitely it's clear that access is so urgent now for patients that we need to find the solutions now. And now I will try to give you an example why it is important now. With hepatitis, this is one of the hats that I've been wearing a long time, being Executive Director of the European Liver Patients Association. Just very shortly for all of you who don't know what hepatitis, but it's estimated that 500 million people around the world are having chronic hepatitis B or C. 90% are not aware that they have the infection. So here we have the first problem: access to screening, access to information, access to doctors. And chronic hepatitis actually has huge burden with lots of complications like liver cancer, like cirrhosis that is increasing worldwide. Here is how is the development of different treatment options throughout the years. You can see in 1990s, actually the success rate has been so low with the interferon 24 weeks treatment. And you can see that in time, the medicines actually have improved. And we are coming to a point in 2011 when we have a triple combination of therapies that is increasing the treatment level close to 80%. And soon we are expecting new drugs that actually will increase the response rates up to 90-95%. But when it comes to access, what do you think? How many countries in Europe actually have access to those new treatments with the triple therapy? Sweden for sure. But you can see here a list of countries that actually 2 years after the innovation was introduced worldwide and in Europe, you can see countries that simply don't have any access or have limited access to this triple therapy that increases so high the success rates and the chances for patients to get treated. And we are talking about definitive treatment. Many reasons behind that. The high price, the high prevalence, and governments are so afraid because so many patients need this treatment, administrative burden, regulatory constraints. Sometimes even the guidelines are not updated properly and the doctors have not done it. So this is some of the reasons. And you can see here not only Bulgaria, Estonia, Latvia, Lithuania, but you can see countries like Cyprus, like Greece, like Italy and Portugal that simply don't have proper access to this innovative treatment 2 years after they have been introduced. So what we can do next? It's obvious we have a problem. If you are a hepatitis patient and you know that you have 70 or 80% chance to get cured by the new treatments, you simply want them because otherwise you know you're getting cancer, you're getting cirrhosis. What we can do? These are the next steps based on these initiatives that we presented. Now, based on the meeting in the Parliament and together with the European Patients Forum, we are exploring how we can bring all stakeholders around the table. When we talk about stakeholders, we mean the politicians, the member states, the European institutions, the patients, the doctors, but also the industry, the generic industry, the innovative industry. Can we sit together and really find solutions that will make those treatments and access to healthcare for patients available now? We are planning, next week actually will be our second stakeholder meeting, where we will actually decide on the next steps and how we are going to form an European access partnership, European partnership on access to quality healthcare, where we will try to search for those solutions that work tomorrow. And I'm sure there are such solutions out there. Maybe good practices from some countries, maybe new legislation, maybe differential pricing, maybe something else, we don't know. But we need solutions that work tomorrow. Which is really good for us. We have quite good political support. In the European Parliament, we have a couple of MEPs. MEP Antonia Parvanova is one of the leading MEPs supporting the initiative within the Parliament. We have Petele, we have Luhan from Romania, who are willing to support politically, internally in the European Parliament our efforts. But I'm sure that we have to start now in order to succeed tomorrow. And I hope this initiative will have great success in the near future, and it will be led by the interest of patients. Thank you very much.